So we took up a fight because we believe that in America, nobody should have to worry about going broke just because of somebody in their family or they got sick.
Economy. The President's health care law continues to wreak havoc on American families, small businesses, and our economy. And it's not just a broken website. This bill is fundamentally flawed, causing people to lose the doctor of their choice, causing them to lose their health plan, and if that isn't enough, they're having to pay much higher prices at the same time. So, House Republicans are going to continue to listen to our constituents, listen to the American people, and try to focus on protecting them from a fundamentally flawed law.
We believe that nobody should have to choose between putting food on their kid's table or taking them to see a doctor. We believe we're a better country than a country where we allow every day 14,000 Americans to lose their health care coverage, or where every year tens of thousands of Americans died because they didn't have health care, or where out-of-pocket costs drove millions of citizens into poverty in the wealthiest nation on earth. We thought we were better than that. That's why we took this on.
A federal policy of fiscal coercion is now at the heart of the debates of Medicaid expansion proposed under Obamacare. And unfortunately, some of our friends and allies in the conservative movement have folded in the face of federal bribery and mounting pressure from special interest groups.
The Affordable Care Act hoped to cover more poor Americans by requiring states to expand Medicaid. But 26 states declined to go to that expense, creating a coverage gap. All of those states have Republican governors or legislatures that are controlled by Republicans. And we asked Elaine Quijano to look into this.
45-year-old Bertha McIntyre needs daily medication to manage her diabetes and heart problems. The unemployed home health aide also cares for her grandson. She does not qualify for Medicaid in Missouri because her family income is too high, about $1,200 a month.
It's just shocking to me when a gallon of milk and a loaf of bread costs $10. There's only so much you can buy with $1,200 a month.
The Affordable Care Act covered the poor by requiring states to expand Medicaid, but many states sued, and the Supreme Court ruled states could not be forced to comply. Now, as many as 7 million people make too much to qualify for Medicaid, but not enough to get help to buy a plan on the new health care exchanges.
So do you just not go to the doctor sometimes?
You just don't go.
I mean, what is that like for you?
I know that my health suffers for it. But am I going to take food out of a child's stomach, or am I going to do without going to the doctor? Which would you choose?
Republican State Senator John Lamping argues Missouri faces tough choices too. He voted against Medicaid expansion.
The entire cost of Medicaid in Missouri is 1/3 of Missouri's budget. It's more money than we spend on K through 12 education. It's 3 times the money we spend on higher ed. We can barely afford to be in the Medicaid program as it exists today. The idea that the federal government pays 100% of the cost for the first 2 or 3 or 4 years, Missourians are skeptical to that. We're trying to make the best long-term decision that we can.
Governor Rick Perry is refusing to add uninsured Texans to the program under the new health care law.
Yeah, Perry says he doesn't want to be part of, quote, socializing health care under a bill that he considers unconstitutional. Under the Affordable Care Act, millions without insurance could get coverage under Medicaid. Expansion costs could be paid by the federal government for the first 3 years, with states covering 10% after it. Texas leads the nation in the number of people who are uninsured. 6.2 million Texans have no coverage whatsoever. Now, nearly 1/3 of those people would have been included in a Medicaid expansion, but today Governor Perry said that will not happen on his watch. Hospitals across the country agreed to cut their Medicaid reimbursement to help fund the Medicaid expansion. Now, Steve Love with the Dallas-Fort Worth Hospital Council says the governor's decision puts Texas at an even greater disadvantage.
We agreed to $14 billion in reductions, knowing that that would help fund this expansion of Medicaid. Now, if we don't have the expansion, so we have these people that are treated with no coverage at all, plus we have the $14 million in reductions, it really is very unfair.
Now, hospitals say without that Medicaid expansion, the ER waiting rooms will just get more and more crowded, and the primary care network of doctors will likely shrink. As for Texas, it is the latest in several Republican-controlled states to reject portions of the Affordable Care Act.
This is Governor Steve Beshear about Kentucky. Kentucky has an unprecedented opportunity to improve the health of our citizens. In the single most important decision in our lifetime for the long-term health of Kentuckians, I recently announced Kentucky will include 308,000 more Kentuckians in the federal Medicaid health insurance program. Kentucky's known for dismal rankings in multiple measures of citizens' health. In 2012, Kentucky's overall health ranking was 44th. In rankings for heart disease and cancer, Kentucky sits right at the bottom. Our rates of diabetes, colon cancer, smoking, and obesity are among the worst in the nation. Expanding Medicaid to Kentucky's working poor will give hundreds of thousands of people the security of reliable medical care, and it will save Kentucky taxpayers millions of dollars in the long run.
Beshear also tied Obamacare to the economy. 2 independent studies concluded that Medicaid expansion, thanks to 100% federal funding, would generate billions in income and 17,000 jobs related to health care.
Well, when you put those economic facts together with being the morally right thing to do for your people, it's a no-brainer.
it's a pretty new thing. It's a health insurance marketplace for Kentuckians, and anybody, children and adults, can get their insurance through this. It's based on your family size and income. You can get discounts.
This part of
The Affordable Care Act. Yeah. That's right.
So the state fair is a big deal in our state, and it provides a great opportunity for us to get folks' attention and to begin to ramp up the communication and information, and reach out to people, let them know what the exchange is.
I've never heard of it before today. Oh, I've heard of Obamacare, yes. I mean, I have heard of Obamacare, but I didn't know what all was involved. Everybody that I have ever talked to is totally against it. They're afraid that the doctors are all going to pull out and you're going to have to be like Canada and have to be on a waiting list.
When he explained this to me, I think it's going to be a really good thing, and I think it's going to be affordable for everybody.
I think it is quite unfortunate that it has become such a political hot potato, but I'm so excited for our state that we are really taking advantage of the law. If it had been struck down, we wouldn't, but it is the law of the land, and as long as it is, we're moving forward.